A lot of the work that we're doing helps Medi-Cal members. We support them with social service needs, so any social determinants of health, we support them with getting access to them, and we do a lot of closed-loop referrals.
Welcome to Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm your host, Logan Plaster, with Alicia Crooks from Pear Suite. Alicia, so good to meet you.
Nice to meet you too. How are you doing, Logan?
I am doing fantastic.
Good.
I have had the chance to learn about Pear Suite over the years, and it has been so cool to see how it's grown. The mission has grown, the team has grown. So start by just educating our audience on what Pear Suite is building today.
Right now, we're building a platform that's for care navigation. We support community-based organizations. We call them CBOs. We work with insurance payers. We work with health centers, health plans, and we're just trying to do care navigation for the community. A lot of the work that we're doing helps Medi-Cal members. We support them with social service needs, so any social determinants of health, we support them with getting access to them, and we do a lot of closed-loop referrals.
Okay,
Yeah.
so care navigation, that's one of those buzzwords you'll hear a
Yeah.
lot at a conference like this.
Uh-huh.
But for anyone watching this that's not in health tech, tell me what that means on just a normal person level.
Care navigation. So care navigation is, let's say for yourself, you need a food resource, you need transportation resource, you also need access to your primary care provider. That's a lot to manage at one time. And normally it's more than those
Yeah.
things. We support with making sure you know who to go to, where to go to. We even call and research for you and let them know that we're going to put you in touch with someone. Someone's going to reach out. So Logan, he needs a food resource. They're going to stop by on Tuesday at 2 p.m. Can you support them with that navigation? And then we call back our member. We let them know. We give them all this information so that they have all the access to the care that they need on the dime, like right in their phone, like right in their hand on their phone or something like
Okay.
that. Yeah.
And you're doing that work yourself, or you said you're working with CBOs, community-based organizations?
Yeah.
Okay.
So we do the work ourselves,
You do?
and we support CBOs to do the work on the platform.
Interesting. Okay,
Yeah.
so you built the platform, and so describe a CBO. What kind of organization are you working with?
Some of my favorite CBOs, I've actually worked with them in the past, is a barbershop called Barber Gurus. We work with Tenna Health. These particular CBOs are out in the community. They're in South LA. The Barber Gurus provide free haircuts to the community. They also do care navigation, such as food resource navigation, transportation, maybe just health education all around. Tenna Health, they are a recent CBO. They are a bunch of, where are they from? A bunch of medical students from Charles Drew University that came together. Some of them are medical students, and they provide care navigation in the community. They do health education specifically for Spanish-speaking populations. Yeah, that's pretty much what they do.
Wow. Okay.
Yeah.
Okay. So a barbershop that is also a care navigator.
Yeah.
I've heard more, sprinklings of that. It's such an awesome idea. The penetration into the community, the regularity of contact with people. I'm sure someone listening to this is probably thinking, that sounds like care that's typically given for free. So let's talk about the business model,
Right.
how it works to provide a platform for folks that are doing this amazing but often free on frontline work.
Yeah, so some of our CBOs have been around for quite some time, or they're a recent startup like ourselves.
Yeah.
That work is normally volunteer work that they're doing for free. They can't get paid for the work, but they have people that have been in the community in pretty much all their life, and now they're getting paid for this particular type of work. So in California, there's a CHW benefit where they're able to bill back through insurance companies to bill for the work that they're doing.
Okay.
So all of that care navigation, the food resource, the transportation, even linking them to their primary care provider supports them with being able to bill for that work.
Okay.
In the past, only the doctor could normally bill
Okay.
for that work through an NPI or something. Now, you don't have to have that. You can just be providing community-based resource work, and now you can build through insurance companies.
Interesting. So I'm sure you're then bringing a source of revenue to these folks as
Yeah.
well.
Yes.
I'm imagining like, okay, CBO, let's say it's a church that's located in the inner city and they do a lot of work with people. In the past, they wouldn't have even have thought about it being a revenue source. No, it's not the point.
And now we're able to build a workforce pipeline. I think the big thing about Pear Suite, what we're trying to do is build the initiative towards what is community health work and how can we really showcase all the work that they're doing in the healthcare field so that we can build this pipeline, this career pipeline for them.
Fascinating.
Yeah.
Which in the past was just like volunteers, kind of blood, sweat, and tears, just like people who are overworked because they just, and now it's actually could be a career, can be something you can get paid for,
Right. Yes.
which makes it
Yes.
sustainable.
Yes.
Okay.
Yeah.
How did you get into this work?
How did I get into this work? I pretty much have been in the community all my life. I'm
Okay.
originally from Detroit, Michigan.
Okay.
I've done a lot of volunteer work growing up. And when I decided to switch over to community health, I had a special interest in community mental health.
Okay.
During COVID, like everyone's shocked. I decided to work for Department of Public Health, and I started working as a program manager doing community health work with particular group that had lived experiences. So a lot of my staff, they just pretty much left the community we were serving. They just left the shelters they were working in. They left pretty much like living on the street. Now they're housed, they're stable, they're feeling great about like their experience in the last year. They wanted to work. They wanted to be a part of a workforce. So supporting them and staff members, either behind the scenes or actually supporting them out in the community, just made me have, I guess, like a passion for this particular work.
Yeah.
Yeah.
And so, what's your role at the company now?
So now I'm a community program manager.
Okay.
I do a lot of the scripting, the implementation, a lot of the building to make sure the language on the platform is inclusive, it's equitable, and so that our CBOs also can understand how to cater the information towards the community that they're serving.
Okay. So at that point, you almost become like a consultant to them.
Yeah.
Not only giving them the dashboard to keep track of things, but actually helping them do better.
Exactly.
Very
Exactly.
interesting. Okay. What do the next 12 months look like? Who are you excited to partner with or work with?
12 months. We actually are working with the National Association of Community Health Workers.
Okay.
We're going to go to DC and do some policy change and advocacy around CHW work, community
Okay.
health worker work.
I'm not that familiar with that community, so
Yeah.
that association. So maybe you could tell me more about that.
So the National Association of Community Health Work is a long,
It's a long one.
long word. They're recent as well
Okay.
because CHW work is growing
Yeah.
across the nation. Some states don't have that necessary like CHW benefit to pay for community health workers, and now we're going to speak to our reps,
I
our
see.
senators, our statesmen to talk about this work and hopefully do some policy changes.
That probably means that you are attaching some clear sort of outcomes metrics, like, hey, if you have CHWs, you can do X.
Right.
What are some of those stories or numbers?
So we actually was awarded a $2.2 million contract to do some training around that to also train up the CHW workforce and provide those metrics. So right now we have about 20 CHWs on our team that work internally to support CBOs. And then we have CBO partnerships around in South LA, I would say 5 in
Okay.
South LA. And their CHW workforce, I don't know how many they have in terms of that, but just building that connection so that they can have a pipeline of revenue to flow for them so they're not getting all their money from grants.
Yeah.
Yeah.
I mean, it seems self-evident that getting that kind of care is going to improve outcomes.
Yeah.
Have you had to sort of prove out like readmissions or, fewer visits to the ER
Yeah.
or, keeping your diabetes, your A1Cs at a certain level? Are there outcomes metrics that you work on?
Yes, we built that into our platform.
Nice.
So a lot of the scripting that I'm referring to allows us to build in those metrics to track. So not only can we track internally, but we can provide that data to our partners to show this is all the work that we're doing, this is how we were able to support. These are the roadblocks that we faced when working with individual members and then as a whole in this particular area.
I love it. I
Yeah.
love it. Alicia, I love hearing about Pear Suite. I appreciate you coming over here. It's been really exciting to see the pretty rapid growth of Pear Suite, kind of the focusing of the mission. I've seen the maturing of this CHW side of the business over the last couple years and how it's aligned with reimbursement trends. Really makes it feel like Pear Suite is sort of at the right place at the right time.
Yeah, definitely. We're trying to build the community at the same time, build up the workforce at the same time, so we can have this career pipeline for CHW work. And I think also give a voice to CHW work in the healthcare field, where a lot of people look at them as advocates or navigators, but we want to showcase them as a prominent position in the work that they're doing to serve the community.
I love it. Well, thanks for coming by and giving me an update.
Yes, thank you.
All right,
Nice to
thanks,
meet
Alicia.
you.